Assalamu alaikum viewers. Please subscribe the channel, like the video and share.
This is very interesting ultrasound of a 30-year-old male. It's abdominal ultrasound and there are multiple findings in this case. See the liver and kidney on the right side. There is echogenic mass within the upper and middle pole of the right kidney, and this is interesting case regarding gallbladder disease or gallstone as well. The patient has got two pathologies, rather three. First is the gallstone, multiple gallstone, then a mass in the right kidney in the upper and middle lobe, and the kidney on the left side is also poorly visible. So you can see the mass that is isoechoic in the upper and middle pole of the kidney, and there is slightly hydronephrosis within right kidney as well. So we'd like to measure the mass as well as the volume of the mass. Renal masses are not very common and they are somehow aggressive if they are malignant because they invade the inferior vena cava very rapidly. So the measurement show that it's about 5 into 4.5 into 5, 4.5 centimeter, and the volume is about 56 cc. They are somehow dangerous if they are malignant, like renal cell carcinoma or hypernephroma, but hypernephroma are very common in infants and they invade the inferior vena cava very rapidly. See the gallstones, they are multiple, small size within the gallbladder. Gallbladder is not much distended. So these are the two pathologies in the same patient. The size of the kidney is about 12 into 6 to 7 centimeter, while the normal size is about 12 into 5 centimeter. So the kidney size is slightly increased and there is mild hydronephrosis as well. See the power Doppler study and you find the vessels or the blood flow surrounding the mass. Mass is isoechoic. Now like to see the left kidney and the spleen. Spleen appears to be normal, but the kidney on the left side, it is poorly visible. This is the spleen that is normal, while the kidney on the left side is poorly visible. So this is an interesting case regarding three pathologies in the same patient of 30-year-old, that is the gallstones, renal mass, as well as poorly visible kidney on the left side. So the patient is 30-year-old male and he is having all of these pathologies, that is gallstone, renal mass and poorly visible kidney. Urinary bladder appears to be normal. liver also appears to be normal.